Well, good night, good night, good afternoon, everyone. It just feels like nighttime. Thanks for coming. I hope everybody's had a safe day with all the rain. I've been in a sewing class all day, so I could hear it, but I don't know how bad it was. So I know at our house it was just nice for the garden, but my grandsons up north at 144 said, it wasn't just raining, Grandma. It was a wall of water. So I don't know how else it was around, but we're happy to have you tonight. We're back with paramedics and potholes, and Paul, our utilities person, will be here shortly. Just running a little bit behind, but we're always relaxed, and we will have questions at the end, but we just want to share with you. Last night, we got out of our meeting about 11:43, and this was a huge discussion again last night. You know that we've had this topic at least 2 other times, and we just continue to share with you where we're at, what we're doing, what the city manager is doing. Things keep changing and working. Chief and Corbin are with us today, and Paul. So it will be a fun time, and just relax, take a deep breath, and help everybody understand where we're at and what we're doing, and some of our discussion last night. For the city council, one of the big things last night was, do we go and poll you all or not? This is a decision that we can't make. You all have to make it, because it's going to involve bond issue and or mill levy, or just a mill levy. So you know that last year we came to you. You clearly said, look at your budget again. You're going to hear that we have. I just want to publicly say to Jody, you have taken seriously the last 6-7 months what council has looked at, said. You've listened, and so there's lots he's going to share with you, where he's been, what he's been doing with his staff, things he's tightened belts on, ways that we aren't sharing, another repeat of what we asked for last year. It is very honed in, and you will know exactly what you're getting for the dollars that we're asking if you will put up for it. So, you want to start out?
Thank you, Mayor. So from right to left, we have Paul Knippel, our Director of Public Works and Utilities. You just met Mayor McNally. I'm Jody Andrews, City Manager. To my right is Fire Chief Erik Birk, and to my far right is our Fire Union President, Corbin Gray. So we're here today to walk through these objectives for you tonight, and then room at the end to make sure we have a discussion and question and answers. So the mayor and I will first open up the session and start with a review of the city's funding challenges for our emergency services and our neighborhood streets, and what the city is doing to tighten our belt. Chief Birk will walk through fire and emergency services needs and where we are today. Paul Knippel will walk through where we're at with streets and our needs, and then we will review those potential funding sources that the mayor referenced. Starting with this slide, and those of you who have been with us through a few of our earlier discussions, we are honing in on our messaging. We want to test with you, so please do let us know at the end whether this makes sense, where you have questions and suggestions for us. 64% of the City of Westminster's budget comes from sales tax. It's actually sales and use tax. So we are a sales tax run or funded city for the most part. Only 4% of our city budget comes from property tax, and that places us in the among the lowest in the nation for what we collect on property tax. On property tax specifically, if you own a $500,000 home in Westminster, you will pay $108 to the City of Westminster annually for your property taxes. Now, that's not your actual property tax bill, because we have school districts, we have counties, we have recreation special districts. Next time when you get your bill or pull up your old one, go down the list and find City of Westminster property tax, and you'll see it should be in that 100 or more range, depending on the value of your home. So the challenge for us around revenue sources is that low property tax rate. And if you look to the right table, we're at the top there and bolded. That's Westminster's rate. We are 3.65 mils, and that's the bottom of the pack. And it goes up from there all the way to 26 mils in North Glen, which is actually one of our immediate neighbors. And so that does present a challenge for you. It's not insurmountable. It's the way that the city of Westminster is run, but it is good to know where our money comes from and how we fund ourselves. One of the advantages of being a sales tax funded city is that there are people who contribute to our revenue that aren't from the city. They're visitors. They're coming to partake in our businesses. And so not all of our residents carry the burden of our operating budget. Some of that is shared by people frequenting our businesses.
And I just want to say we have heard what you have had to say. We have seen you at any kind of event, and you aren't afraid to ask us questions. We share those with Jody. He's worked very hard to look at total funding. How could things look differently? I really want him to dig in and you understand what he's done with his core group of people. He's got a lean concept that the entire city is working on. He has looked that budget over and is going to share with you how he found money that can fund one of the fire stations, so that you won't have to see that on the issues coming up. And any kind of one-time money makes sense to do those kinds of things, because we aren't having to make sure we have money coming in to keep it going. But that's where we can find this one-time money to possibly do the training center and one fire station, but we still have to fill it. And that's where a mill levy comes in, because the mill can be used for personnel and needs to keep things going. A bond issue, and we'll get into this more, is about building. And if we go for bond and mill, the bond will specifically tell you what you're going to get. The mill will be filling the things that we need to build. So tightening our belt, Jody, you are doing a great job, and share with everyone what you've been doing.
Thank you, Mayor. So I've been with the city for 11 years. I've been city manager since September of last year. Came in just in time to see our last ballot measure go to the community. And one of the things that we really heard was the message that the mayor just shared, that we need to do more with what we've already been entrusted with before we go and ask our community for help. So I want to just highlight some of the things that the mayor has alluded to heading into this budget building with City Council for the 2026 budget. I've asked all of our departments to hold flat on their budgets this year and offer up reductions to those. So not only not ask for escalation, but actually reduce our operating budgets heading into 2026. So those of us who buy groceries and gasoline and everything else, we know that costs are escalating, and we're going to offset that escalation, and we're going to come in underneath baseline. I've also asked our department directors to hold our staffing levels flat, meaning we are not going in and asking for additional staff in our 2026 budget. To achieve that, we are looking at restructuring existing positions. So every time a position becomes vacant at the City of Westminster, our directors get together and look at that vacancy and say, is that the best place for that resource, or do we repurpose and reposition it? Since September, when I became city manager, we've already restructured 30 positions. So instead of asking for a street maintenance position, we take a position from accounting and reposition it, repurpose it as a streets position. That totals already $3 million that we're not going to be putting into this year's budget, and that's a continual effort. So that number is already out of date. We're probably pushing more like 35 positions, $3.5 million. We're also looking very closely at restructuring services and partnerships to focus on our essentials, the services that we really need to provide to you. And we are looking at some opportunities in particular that could yield up to $10 million, not taxpayer money, so restructuring an agreement in order to put that money into these needs. And then finally, we're funding, we need 2 new fire stations. We're going to get to that in just a moment. We're funding one of those already, and City Council has provided the leadership on this, $38 million to come from development area funding. So our North Huron urban redevelopment area has been generating revenues that can be expended only in that area. We're going to put that money to use to address our fire station needs in the north. One of the other things, just before I turn it over to the chief, our teams now work cross-departmentally across every department. So when we see a need, we're now cross-training our staff across different business units, meaning that when we may be light on the permit induction 1 week or 2 weeks, those individuals can be redeployed for inspections, for example, without asking for an additional inspector. We're now training up existing staff to take on broader duties to fill in gaps before we ask for positions. I will now turn it over to Chief Birk, who's going to talk with us about our fire and emergency services needs, and then Paul Knippel will talk about our streets needs. That one right there.
Thank you, Jody. Thank you for being here tonight. I will be reviewing some of our operational and infrastructure challenges that we're experiencing in the fire department. The first item that I'll highlight is that we have experienced an exponential increase in calls for service over the last 20 years. In fact, our increase has more than doubled during that time period. When I say that, I think many people think that that increase is a result of population growth. However, population growth is not the driver behind this increase. We analyzed many factors to determine what was causing this increase. And you can see there in the slide that we've identified the community's utilization rate. So in other words, how often the community is using fire department services. In 2004, that rate equated to 1 call per 14 residents. In 2024, that rate equated to 1 call per 7 residents. So the community is using fire department services twice the rate that they did 20 years ago. And so even if our population had remained the same for the last 20 years, we'd have experienced a doubling in our calls for service. A few other factors, as we age as individuals, our medical needs change, and we're seeing an increase significantly in the demand for emergency medical care within our community. And we are the emergency medical provider for the city of Westminster. I'll say that this increase does have operational challenges. Number one, it increases the wear and tear of our current apparatus, very costly apparatus. In addition, our fire department crews are committed to 911 emergency incidents more frequently, which means the next 911 call may be handled by a crew that's further away. And that impacts our response times, how quickly we can get to the community. I want to note that during this time period, we've added very few response resources. And we've operated with the same number of stations we've had since the 1980s. There is a need to add additional resources and stations to meet this increasing service demand, as well as a service gaps I'll talk about later. The Westminster Fire Department is an all-hazards fire department. We provide fire suppression, emergency medical care, technical rescue, wildland services, hazardous materials response, and many other services. It's all designed to ensure that when you call 911, we have the training and expertise to handle whatever situation may arise. But when we break down the operations of our responses, what was actually required to resolve that emergency, we found that 66%, or 2/3 of the time, those operations required emergency medical care. All of our firefighters, regardless if they're on the fire engine or an ambulance, are trained in fire and EMS. And so 66% of the time, they're providing treatment for patients experiencing heart attacks, strokes, seizures, trauma patients, and many other medical complaints. I alluded to earlier service gaps. In the city of Westminster, we have 2 service gap areas, one in the north part of the city and one in the central part of the city. And when I say service gap, what I mean by that is that we cannot respond to those areas and cover those areas within the industry standard total response time of 6 minutes. That includes when you call 911, the time for the crews to get on the apparatus and drive to your emergency incident or the community's emergency incident. Our goal is to meet that industry standard, that from the time you call 911 to the time we're at your door is within that 6 minute period. On the map here, both the map on the left and the right, it shows our response time coverage within the city. And those are the bright colors showing how far we can respond within the city from our existing fire stations. Again, that's the bright colors. And you can see probably best on the map that is darker in color, that center gap in the center of the city. That's an area we cannot cover within that 6 minutes of response time. The response time can be in excess, 6-8 minutes, depending on the location. And then the northern part, again, you can see that that gap that is currently not covered by fire department coverage within 6 minutes. The only way to address that gap is to place a fire station in those service gap areas. And as the mayor mentioned, the North Station would be funded through urban renewal funds and help us build a station there. It doesn't address the personnel, but allows us to build a station in that northern gap. I do want to take a moment just to talk about some of the neighborhoods that would be served by these stations. In the North Station, it would serve the Lexington neighborhood, Huntington Trails, Quail Hill, Arbor Commons, parts of Amherst, the Orchard, and St. Anthony Hospital, to name a few. In the central part of the city, this is a location where we've deemed a central station. We've called it Fire Station 7. That would serve Westcliff, Highland Greens, Walnut Creek, Promenade, Downtown, Sunrise Assisted Living, Highland Hills Senior Living, Trendwood, Madison Hill, Franklin Square, and many other areas. And I want to take a moment just to explain why that response time is so important, why 6 minutes is so important. Number one, from a fire standpoint, a fire doubles in size every 30 to 60 seconds. And I can tell you that fires burn hotter today because of the prevalence of lightweight materials and petroleum-based plastics in our living environment. So the quicker we can respond, we can prevent a small fire from becoming a large fire, protects the residents and protects their property. From a medical standpoint, and I mentioned before, we're the medical provider for the community. The longer somebody goes without oxygen, the higher likelihood that they will sustain a brain injury as a result. That injury could be an impairment, a potential disability, or a permanent brain death. And when we start exceeding 6+ minutes, we start to enter that realm of having or increasing the likelihood of having a permanent brain injury. And so it's very important that we can respond to the community from a medical standpoint in a timely fashion. Additional challenge we are facing is that we have aging infrastructure. Some of our stations were built well over 50 years ago, and they were not built for the modern fire service. The vast majority of the stations, and I'll talk about a few of them here in a moment, but the vast majority of our stations were not built to house modern fire engines, modern ambulances, and the equipment. And that affects our operations, our response to the community. These stations also lack modern safety and health standards. Cancer is the leading cause of death of firefighters, and modern stations have built-in separations where there is a decontamination area that's separate from the living quarters. Firefighters pick up contaminants during emergency response, and that goes back to the station. They need a place to be able to decon those. And then the stations themselves have vestibules or separations to ensure that firefighters aren't continually exposed to diesel exhaust, which is a carcinogen, and that their bunker gear isn't stored right next to the diesel exhaust. So when they put it on the next day, they're not absorbing those diesel exhaust and other contaminants. Our stations were not built with those. Again, they're built 40, 50 years ago, and so these stations are lacking as modern health and safety standards. And most of these stations were built at a time when Westminster Fire was almost an exclusively male workforce. They were not built for a modern workforce, and we do not have equal amenities for all of our firefighters. I'll talk a little about our training tower here in a moment. Our fire headquarters is just across the street at the Public Safety Center, and we have outgrown that space and no longer meets our operational needs. We have administrative staff that are working at various fire stations because we don't have space in admin. Some of them are working in retrofitted closets and storage rooms to be able to have a space to work. So when we talked about that central station, we have plans and hopes to build that headquarters, add headquarters to that central station. Okay. Last slide for me. So I mentioned before some of those common challenges, the lack of storage space for our apparatus, our equipment, safety and health standards, as well as unequal amenities for a diverse workforce. Fire Station 1 is a station that's our oldest station, but it's structurally sound, and this is a station that could be renovated or modernized. It needs to be modernized to incorporate some of those safety and health standards, again, address some of the needs of a diverse workforce, In addition, this is our busiest station, and it's a station that we may need to add additional resources to meet future service needs. It would require additional quarters, living quarters, and so it'd need to be modernized for that. Station 3, which is located just off of 90th and Wadsworth, this station started out as a modular building for our volunteer staff, and it's already been expanded 4 times. It's reached its electrical capacity. We cannot renovate this station. This needs to be scraped and rebuilt, and it can be rebuilt on the same site. One reason why this station really needs to be rebuilt is it doesn't meet our operational needs. We have our dive team that is assigned to this station, and ideally you have your dive team, your dive van, and your dive boats in the same station so you can efficiently respond to those emergencies. We cannot fit our dive van and boats together at this station. It doesn't fit. They don't fit. So we have our boats at a different station, our dive van here. And so that means if we have a water rescue call, we have to respond from 2 different stations and join up. That affects our response time in a negative manner. It's very difficult from a response standpoint to work out of this fire station. Fire station number 4, we also have challenges fitting our apparatus in there. Our engine fits in there, but it is very tight. We've changed our ambulance design from a van chassis to a truck chassis. It's a pretty common change in the industry, but that additional length from van to truck, it may not fit in that fire station when we receive it. We'd have to park it sideways or bring it out front every time we need to open the doors to put equipment in there. Otherwise, we're going to have to remove a load-bearing wall. One big challenge with this station is that it's downhill from a park, so we get a lot of water from that park. It's right next to a creek, and we get water from that creek. We've had a lot of flooding issues, settling issues, and their structural concerns here at this fire station. And this is one that, again, would need to be scraped and rebuilt at another location due to the water concerns that I mentioned. And the last is our training tower. This is located in historic Westminster. It's limited in nature, that doesn't have burn capabilities. It allows us to do rope rescue, limited hose drills, and some ladder training. We have a need to train our crews ongoing and to have that comprehensive burn training on a routine basis. We can't do it here, and we're reliant on our community partners to use their training facilities, but they're rarely available. The need for training facilities has increased immensely, and we're having a hard time getting our crews secured for training and participate in a training facility. So this is a facility that we would like to replace and build a comprehensive training center next to that central station. And as Jody and the mayor mentioned, we're trying to do that with external funds that don't come from the taxpayers or the city budget.
And before we go to streets, Corbin, you live and breathe this. I haven't had a chance to ask you, I don't know how many, because I know you switch stations, and I don't know how that all happens or who decides where all you're going to be sitting at. But share what your shifts look like, if you've been at different stations, what have been some of the differences. You've heard what Chief has said. Just give a true, let the folks know what it's like being in the trenches. You're there. You respond to these calls.
Yeah, absolutely. So I am not currently stationed or assigned to any of these stations, but that doesn't mean that I don't have a lot of experience working out of these stations. So the way that our current structure works is that we work 2 days on, 4 days off, so a 48-96 schedule. And with that, due to different vacation time or sick time, we have to do what's called roving. So they will move. There's whoever is in charge of the staffing officer for each day or each set will move firefighters around to different stations around the city, depending on vacancies, to make sure that every station and unit is properly staffed. So because of that, I do have a lot of experience working out of these stations. I've spent actually the majority, although I'm not stationed there, I have spent the majority of my career at Station 1. But I've done my fair share of shifts at Station 3 and Station 4 as well. And I can just to echo on some of Chief Birk's comments, that Station 3 specifically, because of the layout that's inside of the apparatus bay, it has an effect on our response times and the way that we operate. There was, when these stations were constructed back in the 70s and 80s, it was very difficult, I would imagine, to forecast what current day would look like. No one at that point would have any idea that Colorado and the metro area would experience the growth that it's experienced. Nor could they predict the changes in apparatus size. There weren't even medic units assigned to these stations at that point. The expansion of our dive team, all this stuff was very, very difficult to predict at that point. But now that we have made these strides and these changes, because of that, it is affecting the way that we are able to access our apparatus into the bay, because we've increased staffing. So we have more gear lockers. The gear lockers are at Station 3 specifically separate the engine responds out of the middle bay. The dive unit responds out of the furthest bay, with gear lockers right in the middle between both of those. So because of the limited space, that impedes access to get to those units when those 911 calls do come out. And, Station 3 and Station 4 both, like Chief Birk again mentioned too, the risk for cancer, that is on the top of all of our minds. We are constantly evaluating and making changes to improve firefighter health and safety. And because of that, we know the increased risk that diesel exhaust gives us for cancer. We have pretty much all of our stations, because that wasn't a concern when they were constructed. The day room, which is where we spend the majority of our time when we're inside of the station, leads directly into the apparatus bay that is constantly filled with exhaust, even though we do have very high quality exhaust systems now. They're not perfect. We still are backing an apparatus before the hoses are hooked up. There's still a lot of exhaust that goes into that bay, and the only protection we have is one single swinging door that leads into the day room, where most of the firefighters spend the majority of their days. Health and safety is constantly at the top of our minds for our firefighters. So there's a lot of advances that have happened even in the last decade of ways that we can improve life at the station to try to improve the quality of life for our firefighters.
Thank you. And before we leave this slide, Chief, would you just explain, right now we're at the mercy of other people to get our people in to train. So explain that training tower and why it would be important, and actually it'll help be a moneymaker.
Yeah, thank you for that, Mayor. So as I mentioned before, our training tower has limited capabilities. And so our training academy, the Westminster firefighters that we hire, we send them to a training facility that actually belongs to North Metro and is co-owned by Thornton. It's about 168th in York, so quite a bit up there. So when we're training our crews, we have to send them all the way up there and away from our emergency response here in Westminster. But when we're hiring people, we send them to that academy for about 9 months, 6 to 9 months, depending on the duration. That limits our ability to use the training site that North Metro has during the year, because it's used for academy. It also does not allow us to hire but once a year. And 13% of our station staff right now are assigned to that training center, and right now that's all being backfilled by overtime. That's really increasing our expenses. We need to be able to hire more frequently, and we can't do that without a comprehensive training facility here central to Westminster. And so if we were able to build that new training center here in that central station, we'd have the ability to bring in Westminster academies, hold our own academies, onboard quicker, get firefighters in the seat quicker. There is a demand, as I've mentioned, for training facilities. And so that is an opportunity where we could actually rent out our facility, managing, of course, to make sure that our needs are met, but rent that facility out to others that are in need and potentially bring in some money to help offset the expense.
Thanks. Now, that's the paramedics part of what I started out with. So now we have the potholes. Paul.
I'd like to think of it as good pavement, hopefully is what we want to focus on. So I've got 3 slides here, and we just want to talk a little bit about how we manage our inventory, how we know what we have out there, how we track the condition of our pavement, what goes into the condition assessments, a little bit about how pavement is built and what the structure of it looks like itself, somewhat about where we stand right now and where we're trending. There's a correlation between funding levels and pavement condition. Then, what are some of the ways that we can what are some of the treatments that we commonly employ to keep good pavement in good condition? So with that, our heading slide here is neighborhood streets. And part of the reason that we're focusing on that is because that is the overall lowest average condition score that we have in the city of anything. We have neighborhood streets, and then we have thoroughfare streets, right, that are longer, carry more traffic. And generally it's divided out in that way. And the thoroughfares are in generally better condition than the neighborhood streets are. So just a little bit about some of these numbers on here. We have about 1,300 lane miles of pavement, asphalt pavement in the city. And a lane mile is one lane of traffic a mile long. And because not all streets have the same number of lanes, so we measure it in lane miles. And we have about 1,300 of those. And we go out and we do a condition assessment of that pavement annually. And when we look at the condition, we look at the number, the cracks on the surface, the rutting, and whether just general, what's the surface like of the pavement. But then we also have some tests that we run where we're investigating the subgrade. So pavement has an asphalt surface on top of it, and then it has a stone and earthen base between it, which provides the structural support for the weight on top of it. The asphalt gives a little bit of structure, but it's really meant to seal off the roadway and keep water from getting down into that subgrade structure. And that's where you start having potholes and where you have big ruts in the roadway and heaving and your road falls apart. So the trick is to keep that top surface in good condition. And so we measure that. So we measure surface condition and subsurface condition, and it comes up and it yields what we call a pavement quality index, or PQI. And our PQI right now, when you compare to other cities in the state of Colorado, is in the bottom quartile, bottom 25% in terms of the quality of that pavement. We right now, just for reference, our current number is about 55. We think that as a staff, we think that that's an appropriate target goal. We don't necessarily have to have excellent pavement. That comes with a very high cost to just maintain things. We're not proposing that our pavement is the best in the state of Colorado. But what we do really want to stay away from is that orange and red area where we get into poor and failed pavement. That's if the city of Westminster slips into that area with most of its pavement, it's going to be very, very difficult to build out of that later on. It's about a 1 to 10 cost differential between preventative maintenance versus full reconstruction. So we want to do the things that don't cost as much, that prolong the life of the pavement, and stay away from, do more of that and kind of get away from then where we have to do full depth reconstruction on pavement. So our goal is really to maintain a fair condition within the city of Westminster. Right now, for reference, the neighborhood streets are in the mid to low 40s as an average. Some are better, some are worse, but generally we're kind of in that mid to low 40 range, which is teetering on poor condition. Our thoroughfares are 65 or so, upper 60s, so they're in fair to good condition. But it all balances out throughout the entire network at about a 55. So, as with anything, the costs have gone up with construction, with the price of oil, with concrete materials, and we have raised and increased the amount of money that goes into pavement maintenance over the years a little bit, but not at the same rate that these construction costs have gone up. We have a street crew in Public Works and Utilities. They do a lot of good work on spot repairs and emergency responses to things. They don't do a whole lot of this kind of work. We contract out most of our preventative maintenance work. It's under heavy traffic. They're extensive jobs. we're not proposing to hire more staff and equipment to do all this kind of work. So for the foreseeable future, the strategy will be to continue to contract out our pavement maintenance program for the most part. This chart here has a little bit going on with it, but it basically shows kind of the inverse relationship between costs, funding, and the pavement quality. So this graph illustrates kind of what happens to your pavement at our current funding levels over time. If we just keep the same dollar amount that we're putting into our streets for the next 10 years, those yellow bars indicate what happens to our pavement quality index, and we slip down into that low, fair, poor, failed range over the next 10 years pretty rapidly. And this is modeled, that we're not just showing this up here as just some sort of illustration. We do have models that you have all these different variables, and you can put in funding amounts, cost of material, what you do every year, and it will predict where you're headed. And but generally, this is what happens. So if we keep the funding level the same, those yellow bars trend down. That's our overall street network pavement quality index, and you can see that against the backdrop of rising asphalt prices. Now, I don't know that asphalt is going to jump to $254 a ton in 10 years. Probably not, but it's going to go up. It's not going to continue to stay the same. So the future predictions, this is somewhat representative of that. It's not exact, but the message is still the same. At $9 million a year annually, which is kind of where we are right now with asphalt alone, the trend is downward for our pavement quality. Okay, that's that.
So council has been talking since the day that the last mill levy did not pass, and looking at, okay, so what can we do differently? And I started out with, we heard you loud and clear, that we needed to first look inside. Jody has shared that. He has looked and has two of the projects coming off that we don't have to come to you with. But as we looked at budget scenarios, because we've been working on the budget since February, every month or maybe twice a month, and roads came up that we've got some issues there. So what you're going to see is, while we've taken some things away to keep costs down, we had to add streets, and we'll sort of explain all of the different scenarios. Like I said, council approved polling last night to go out. I don't know who in this room might be lucky enough to have a poll taken, but you're welcome to let us know what you think. But the basic service option is a 0.35, and it fills the emergency medical service gaps. It builds a new central fire station to close central service gap. It hires the firefighters and emergency medical staff and operates new central and north fire stations. And it dedicates $2 million for the neighborhood streets. It does not give us everything that you've heard the chief talk about. So I want to be clear about that. The comprehensive option includes a capital bond, and I talked about that at the first. A bond payment can only be used for building. So you know exactly where that money's going. We can have bullet points, and we talked to the pollsters yesterday about when this has to be written for a bond issue or a issue going to the voters, ballot issue. We need those bullet points so it just doesn't have a bunch of words that say we need this much money, but you don't know exactly what it's going for. This will tell you exactly what the chief has told you that we need and what Paul has told you the streets need, and that will be very clear. And that will be for a 0.25% sales tax and do we have what the bond's going to be? Where did I miss it? 4.1 mils for the bond. So the basic service option, I've told you really what that is. It just meets some of the high points, but it doesn't get any of the remodeling done. And you've heard from Corbin, and I've been in some of those stations when I've been on ride-alongs. Thank you. It's not that. It's just there weren't women back then that were in the stations either, and so we just have some things that could be much better. And 3, I don't know how they do what they do. 3 isn't as big, I don't think, as this bill as we're sitting in. I mean, honestly, it's probably half. That's how it feels like if you go in there. And like you said, it can't take any more electricity, and then, heaven forbid, the internet and everything. So the comprehensive one with a bond and mill combined, but both of those have to pass. You could pass a bond, but we can only build, but we can't fill. So somehow we have to get that clearly across to people. It's lower than we were asking last year. It's getting you everything we need. We've taken out some things, and Jody's found ways to do one-time stuff, to be lean and mean, and we've brought in roads because our firefighters can't drive on the streets if they get sucked up with the potholes. So the bond it goes away after 25 years, and so that piece is gone. It's, to me, that's the clean one, but we're waiting to see what you see or hear, what you say on the polling. We haven't made a decision that we're going this fall. We're in the assumption and in the mode that if we do, we're going to be ready. Last year, I will just say from City Council's point, we weren't a part of it. We were, I can say this, nobody else can. We were really stymied and put in our place of what we shouldn't be doing and let somebody else do it. That was wrong. I have talked with Corbin and some of the firefighters that it won't happen this year. I've started calling people. We're going to get a citizens group together. We already have, and I shared this last year, but it never got passed on. There is a citizens group that's filed with the city over all these years. It's still sitting there. It has money to get started, and we just have to fundraise to keep it going so that the next issue, once we're done with this one, will be there for the next set of things. That's all in place, and I've got all of the phone calls made to knit all of those things together. If there's anybody in this room that wants to get behind this effort, happy to talk to you. But that's sort of where we left things last night. Polling will start Monday or Tuesday. And will then come back to us as soon as they can with what comes from that, and we'll go from there. And we did last night, because a firefighter suggested paramedics and potholes. That explains what we need. And I know you'd rather have streets maybe in there, but the P and the P really come off, you know. We sort of liked it, but we're not married to anything yet. But anyway, we wanted to share that with you tonight. So what questions do you have? Yes, sir.
On the comprehensive option, the sales tax part I get, that's easy to understand. The bonds, now are those floated by the city? Do people buy those? And that, so that's kind of an option that a person can buy those bonds, and residents don't necessarily are necessarily responsible for those bonds. Is that correct?
The city's responsible for them,
Yes. Okay.
and we pay them back.
Second question. What's the population of Westminster?
Latest numbers?
The census data tells us 115,000. We're probably getting closer to 118,000, but we wait for the census data because that's the official number.
And third question. If I call 911 with a medical emergency, does it go to the fire department here, or does it, and if you're busy, does it go to a contracted fire emergency response team, or what?
If you call 911 for medical emergency, it'll go to the Westminster Dispatch Center, which is right across the road, and that's Westminster Fire's dispatching service. So it'll go directly to us through our dispatch center. Again, we staff the fire engine and the ambulance, and so the Westminster providers that are responding. We work very closely with our partners. I mentioned the response times, and we've leveraged every possible partnership we can to enhance the response times to our community. What we did is we partnered with 7 agencies around us, North Metro, Adams County, Brighton, Thornton, and 7 total agencies, and linked our dispatch centers together. So we have AVL data of all of those fire department resources every second, and if there's one that's closer, we hit a button and we can send Thornton to that call. That way, the community gets the fastest response possible. And so if Westminster was not the closest unit because we're on another call, they could pull in a unit from North Metro or Thornton or another agency.
And I should, if I could, Mayor, I should add that, so our communications 911 center right across the plaza here, it's also for police. And so our 911 operators actually function out of our police department, but they respond to fire and police. We haven't changed those staffing levels in years. And one of the things I'd mentioned, I'm driving for a flat staffing budget. I may ask City Council for one additional dispatcher to address this fire load that we're seeing, but we'll deal with that in the budget. But just to be clear, what the chief described is computer-aided dispatch, or CAD, and our CAD to CAD relationships are highly evolved. That's how we've managed to continue to provide the expected response times in Westminster, but it draws on our neighbors.
Saturday, we have an open house in this courtyard area, and open house over at Public Safety. Are they going to do tours? And I don't remember if last year, because I was working outside, did they show people the 911 dispatch area so they sort of get a feel for what these people, I don't know how they ever have a moment to take a sip of water. But.
Unfortunately, I don't know if there'll be a tour of the dispatch center this year. I know 2 years ago there was a tour, but I have not seen the agenda for that, so I unfortunately don't have the answer to that.
Sign up for C-Fire or WCPAA, and you guys then can go on a tour.
And I would, Mayor.
Somebody's shaking their head. Yes, there's going to be a tour.
Yes, and there is a tour. Please come by on Saturday, 9 o'clock in the morning to 1 p.m. It's a police, fire, public works and utilities, public safety event. Community's welcome, children especially. Everybody's welcome. We will have a helicopter landing. It's a pretty big deal. Your family, if they come with you, can paint our snowplow blades this year. Anything they want, you should show up for that.
You're going to have big toys there, right?
I'm not sure what all we've got planned. We'll have the snowplow blades out there and probably a truck or two as well. But we're not painting the trucks, just the blades. Just the blades.
Oh, yes, ma'am.
My question is about the fire stations. So the ones that need to be replaced, you mentioned they have to be replaced at a different location. Do you own that land where they would have to go, or is that part of the budget?
Thank you for the question. So the 2 stations that are currently the existing stations that need replaced, Station 3 would be replaced on site, so we own that land. Station 4, because of the water challenges that we're experiencing, would need to go to another location. We have not determined a location yet, so we don't have land that we own that's ready-made for fire station number 4, so that would have to be part of the budget.
And then the ones that have to be updated, what happens to the firefighters that are assigned there?
There are a lot of options. Some of our neighboring agencies, when they've had to do some remodels, they actually had trailers that were outside of the station, and they lived in the trailers and then still worked out of the apparatus bay. They still have their units there, but they live in a trailer. Adams County, years ago, had to remodel one of their fire stations, and so our firefighters and their construction abilities built additional rooms at Fire Station Number 1 to house Adams County for a period of time. So we have some options and some flexibility, but the thing I see most common is a trailer that's outside the station where they reside.
Yes.
Could you walk through the thought process on, you did mention the property tax amount is pretty small for Westminster. On you know, how you ended up coming up with a sales tax versus bond versus potentially a property tax increase, and why you decided not to do anything with property tax.
The bond is 14 mills, and it is on your property tax. That's where you're going to see the bond issue.
4 mills.
4 mills, because that's the only place to put it. If you look at your school district stuff, you're going to see Jefferson County is where I live, Jefferson County mills. You're going to see Jefferson County bonds, and you would see Westminster and Westminster bonds. But when we do those, the people in with statute and stuff have to vote because the city's being encumbered with that. We have another piece that's certificates of participation, which I know some know that we have used for courthouse and stuff. That's just another tool in the toolbox, but you have so much you can use in each of these different areas. So I worked in a bond house for 10 years. I helped lots of cities around the state work on their bond issues, school districts and cities. I just know that people, if they, in the question, and this is the key, and we talked about it last night to our attorney, the key is not just having the words that say, because Tabor has its prerequisite of what you say and how you say it, and it goes everybody, but if you put those bullet points so you know exactly what's going to be built, that's the accountability piece that I like. Because, and bond money can only be used for building, where mill levy can be used for both. And so last year, when the decision was made to go for mill, it was including all of the stuff being built and putting the people in it. I questioned that behind the scenes. This year, I had people that asked questions, got educated in what a bond is, and we're able to discuss it, and it's just one of the options. So, but that's why I like it, because it is an all mill that could go for anything and everything, and it never stops. Or it can be the bond piece that we need to build, and then it's gone, and then the mill that helps fill what we're building.
In the past, so why is Westminster's property tax rate so low? It's been low for decades. In the past, when the city's gone to the community and said, hey, how would you like us to raise your property taxes? They've said no, and it's been held down. Even with this data, our community says, no, we really like that our property tax is $108 a year. Thank you. So what the mayor has described, and we're going to poll early next week on this to see how our community responds to a specific bond issuance for this purpose only, that's repaid as a separate line item on your tax bill. You see a capital bond repayment for fire stations and neighborhood streets. And once that bond is paid off, that goes away. It's not a permanent increase in your property tax rate.
So what happens if people don't vote for the bond and vote for the smaller mill levy? Where does that leave?
So the question is, what if the community only supports the second part, which is the 0.25% sales tax increase? Well, that will bring us personnel. We are able to build Station 8 with other funding sources, not taxpayer funded. We will be also able to build the training facilities, not with the bond money. And so we will be able to use that money. We can pour more of it into streets in the early years until we figure out how to build that central station and then we'll have the staffing for that. So that sales tax would give us more flexibility for operating costs. So we would staff Station 8. We would be able to utilize our new training facility, both of which are funded separately from this initiative, and then the rest of it we would put into Paul's pavement.
Susan?
Is there, like, what is the timeline for this? Like, how soon would we see these fire stations going into operation? And like, years, months, you know, like, if you don't even have a land before, so it doesn't seem like if you fund it, that you're really prepared to do it.
Thank you for the question. The question was how quickly will these fire stations be built and how quickly they'll be in operation. If we have a ballot measure in November and passes, our first order of action is going to secure the property where we can build, for example, fire station number 4. Typically, to build a fire station, it's a 3-year process. So if it passes, we're 3 years before those fire stations come into service. And that's one of the things that we talk about when we're having these meetings, that there is a community need for these stations now. And the longer it takes to address them, the longer it is before those stations are in service. But it takes about 3 years. Again, Station 3 is a little bit different because we have that property available right away. And it depends on the type of funding and how quickly that funding comes in, gives us flexibility as well.
And I would add, that is the reason why we're getting questions sometimes. Why would we go back out to ballot a year after the last one and it didn't succeed? And it's exactly for this reason. The cost escalation since we went to ballot last time has been significant on fire stations in particular. And so every year that we don't have capital funds to begin these constructions, we do get further and further behind. So that's what we're polling on. Next week, I hope some of you in the audience get the polling. We're going to, I think, poll at least 1,500 residents, possibly more than that. And that data will come back to us and will let us know how Westminster feels about these options.
And some have said, what's changed from last year to this year? Well, there's been a lot. We shared that up front, what Jody's already done. He's scoured that budget, how he's looking at the whole budget for next year at personnel. Talk about the cross-training, and I know we have a question here we'll get to you, but talk about cross-training and stuff, what you're doing.
Yeah, so one of the programs we have is a rental housing inspection program. We're leading in the state in that regard. So we have inspectors that go out annually and inspect apartments to make sure that they're safe living conditions and the tenants are living in a safe environment. The program has ebbs, high demand and lower demand peaks. At the same time, our building inspection, which is actually responsive to our building community. So when building permits come in, our inspectors come out and inspect those construction projects. Those are 2 different pods of inspectors in the city. So that's one example of what the mayor's talking about, which is cross-training. We're now cross-training both those teams. And so now our building inspectors can do rental housing inspection when rental housing is in high peak. And our rental housing inspectors can do building inspections when our building inspection's at a peak, and that we can handle peaks in both of those areas without adding any staff. And that's different, I think, than in the past. I would add one note on that. Like any employer, we have a turnover rate, right? People retire, they move with their families to other locations for spouses' jobs. Every time that happens, we look at that position and say, is that the right thing? Is that the right place for that resource that we've been entrusted with? And so far, again, 30 of those we've repurposed and repositioned, and that will continue to happen. We can't do that with firefighters. You've heard that our firefighters are both firefighters and paramedics. And I don't know if you caught what Corbin said. He said that 2 days on and 3 days off. The 2 days is 48 hours straight. We have firefighters and paramedics in here. Thank you for everything you do. I have tremendous respect for you, because imagine what it's like to work hour 1 all the way to hour 48 before you get a break. So hats off to our firefighters.
And that's one reason why when all of this started, and it started coming back the day after the last election failed, I emailed Jody at 5:30 in the morning and said, our work just began. And so we have honestly been working and talking and working with council, and he's been working with staff and the chief and Paul with streets, and it's a conglomeration of the 7 counselors talking and asking questions, and we don't always see eye to eye, but that's good because this person brings this up and this person brings this up until we come full circle again and say, these are our first responders. Sit and wait till next year, and that's now, last year went by, this year's gonna go by, and we could start seeing things out of the ground by next year at this time, or in November. So why would we do that when it has not changed? We have a need. You all need to understand that if you have a heart attack, have something happen, that you have a stroke, whatever that needs to flow to your brain with oxygen and blood, and they can't get there in less than 6 minutes, you're dead. Simple as that. And I have to tell you that because these people can't be held responsible because we didn't come to you and say, here's the need for you. You had a question.
I did. I was just wondering why there's a differing sales tax between the comprehensive plan and the basic plan. Was the numbers, like, that's a 0.35%?
Yeah, so that's a good question. So the question is, why is there a different sales tax between basic option and comprehensive option? So the basic services option, there is no bond associated with that. So to fund capital, we would do it through sales tax. So we would collect those sales taxes, pool them, and when we had enough, we would embark on the central station and build that, and the rest of that sales tax goes to operating the 2 new stations. That's it under the basic services. So fire doesn't get Station 1 remodeled, and they don't get Station 3 and 4 replaced, and they don't get a training tower, training facility. So the basic services option is the, or new headquarters administration building. So the basic services just basically adds 1 fire station. That's the central station and the personnel to operate the 2 fire stations. The comprehensive plan has a lower sales tax, 0.25%. That's in perpetuity, so that will fund the personnel for both new stations moving forward. The capital is actually funded through the bond, so there's a different or a second funding source. The bond is issued, the money comes into the city, and then immediately we start to pay that back by putting a line item on your property tax bill which is a bond repayment. So that bond repayment will show up each year for 25 years until the capital is paid off. So this option keeps the sales tax lower, the increment lower, and it burdens your property tax for 25 years with that bond repayment line item. Then it goes away.
So then historically, when we've had stuff like this come up, are people more likely to want to pay less of a sales tax then and be more willing to pay for a bond? Is that why
I work with all the metro mayors in the area, and once you start going over 9%, it gets scary because if any one of us hits 10%, you all were revoked. So we just know in the sales tax, it's not just people that live in Westminster that pay for it, and that's part of rationale, is anybody that comes and pays and does things here pays it to help, because they could be the ones that they have to call 911 in a restaurant. I mean, it happens. So some see it as a more fair tax. But by splitting this, we have some people that have started coming to our meetings at our public meeting in, was it April 3rd? It was around there. We had a town hall, and this is all we discussed too, was streets and first responders. And there are some that when we explained how low our tax for the homes are for property, they said, well, that's a no-brainer. Well, It isn't a no-brainer. Golden is a city that passed theirs. It took them over 2 years. It wasn't for this kind of stuff, but it took them 2 years to really lay that groundwork. It's a harder sell. But I believe, because if you use the bond issue that, yes, goes onto the property tax with those mills, and I'm sorry, we don't have calculated yet what that's going to be, but with, you said 4 mills? And I'm sorry that I said 14.
Yes.
Scare you. See, it feels better already. But with 4, when things, as soon as, we're working furiously to get things right, to give you choices, and for you to tell us. I'm just sitting here tonight, and I can tell you, I have a council that last night, and we've gone back and forth, and like I said, we haven't decided for sure this is the year, but they know what these men and women in our firefighter suits, in that first responder every day, 365 days a year, are dealing with. And how can we just sit here and say, no, we're just gonna wait? We need to see that polling. We need to see what happens. We all need to get busy and start fundraising for this campaign so that we can continue to educate. We have been working on that since February, and those of you that have been here hear the common theme, and you hear how we've been changing and looking, and that should give you some stability to know we aren't just throwing this at you. It has been hard, thoughtful, and almost bloodletting to figure out where we're squeezing that radish to get what we need to get. So stay tuned, and I see we've gone over our time, sorry, but you're always such a great audience. You ask great questions. We'll stick around if you have some other things. Like I said, if you're interested in being on our Citizens Committee, Speakers Bureau to go out, if you have a HOA, if you have a service group that you're in, we need to know about it and know when we can come and talk to you, because everyone needs to understand the story. They need to understand what our firefighters are going, what their conditions are, what we need as a public, so that if you're the one that has the heart attack or the stroke or the fatal whatever, that we have somebody coming to your rescue in the time frame that they can help you. Thanks for being here tonight. Thanks, Corbin. Thanks, Chief. Thanks, Paul. Thanks, Jody.
Thank you all.
So I edit to the slow.